Now, live from Washington, here's Larry King.
Dr. Jeffrey Klein, the dermatologist out of Orange County, California.
Dr. Klein gave me my body back.
Dr. Klein himself has performed more than 6,000 tumescent liposuction.
Tumescent means swollen and firm.
From ABC News,
Welcome to liposuction.
The development of the Tumescent technique by Dr. Jeffrey Klein.
Dr. Klein, please come back to San Juan.
Dr. Jeffrey Klein, the inventor of Tumescent Liposuction.
Hi, I'm Dr. Jeffrey Klein, and I invented Tumescent Liposuction. Liposuction is accomplished by using stainless steel tubes called cannulas to suction fat from under the skin. Although such large cannulas can remove fat quickly, they are less accurate than smaller cannulas. They also require larger incisions and therefore leave larger scars. With the Tumescent technique, local anesthesia is used in place of general anesthesia. Local anesthesia is much safer because it avoids the drugs that cause depression of respiration and possible allergic reactions. The advantages of the Tumescent technique for liposuction over general anesthesia is that it is much safer, there's virtually no bleeding, the scars are just about invisible, the results are much smoother, recovery is much faster, and there's much less discomfort. Let's take a look at a typical procedure.
Morning.
See you in a bit.
Okay, I'll see you in a bit.
Right through this door.
Okay, great.
Okay, and we're going to come in here and get your vital signs and take your body temperature.
Take two. I'll give you a copy of these when we're all done.
Great. Oh.
Before beginning the surgery, Dr. Klein draws two kinds of lines on Christy's body. The round circles identify the deepest fat areas.
Well, goodbye, thighs. I'm so sorry.
Goodbye.
We have to do this.
We have a cheer in here. It's called Hip Hip Away.
Under local anesthesia, Christy feels no pain while Dr. Klein works to remove the fat.
Hello? Yes, I'm very happy. And
She's even comfortable enough to talk on the phone while he works.
well, thank you. You know, he's doing it right now as we speak. And I don't, yes. No, I feel, the only thing I feel is the pressure of his hand. And that's about it.
The new liposuction technique allows surgeons to work closer to the surface of the skin. And the new instruments are tiny, some no more than 1/8 of an inch. The best surgeons possess both technical skill and artistic finesse.
You're doing something under the skin, and you feel around very carefully to make sure that there are no areas of lumpiness or bumpiness. It should feel smooth everywhere.
Wow.
At the end of her 5-hour surgery, Christy Turley saw the difference immediately, and she was overwhelmed.
I'm glad I did it. Thank you. You're welcome.
2.5 weeks after undergoing liposuction, Christy's body is still shrinking. She won't see the final results for 2 months. But husband Tyler is amazed right now.
Yeah, I can't get away. I'm going to pull the mirrors out of this house. I can't get away from him. She keeps looking at him, yeah.
Christy is already 4 pant sizes smaller.
I had to borrow some pants the other day because my pants don't fit me right, and my girlfriend's a lot skinnier than me, and she loaned them to me. So it's kind of nice to put on her pants. My jeans may be by Calvin, but my body's by Klein.
With the Tumescent technique, the aesthetic results are generally better than with general anesthesia. This is because the instruments are so small that we've just about eliminated the risks for any irregularities of the skin or rippling after the surgery. Because the incisions are so small, we don't need to use any stitches, and the scars become virtually invisible. With the Tumescent technique, most patients can return to work in about 2 days, and they can restart their exercise program in about 2 to 5 days. Liposuction is more than a surgical procedure. It is a handcrafted work of art. The goal is to individualize the procedure in such a way that dramatic results can be achieved without leaving any evidence that a surgical procedure has been performed.
I decided to have liposuction because I was very uncomfortable with my body. I was uncomfortable with the shape, genetically, what I was given. I knew that the only way to take care of it was by having liposuction. I chose the Tumescent technique because I did a lot of studying on it, and I decided that I wanted to have surgery that was quick, that was pretty painless. I had heard that there was hardly any bleeding involved, hardly any bruising. I could get back to work and be on my feet real quickly after this technique. My experience at the Capistrano Surgery Center was wonderful. Everyone there was so kind. They were very concerned about my modesty and very protective, and they couldn't have done anything more to make the experience more pleasant for me.
I am delighted with the results. I had been ashamed to be seen in a bathing suit and felt out of place at the club in workout clothes, and now I feel comfortable everywhere, and I'm delighted. Dr. Klein gave me my body back.
So, if you're considering Tumescent liposuction surgery, I'd like to invite you to telephone our office to schedule a personal consultation with me.